One of the most common orthopedic problems of dogs is the rupture of the cranial, also referred to as anterior, cruciate ligament in the knee. This ligament helps hold the femur bone to the tibia in the lower leg and prevents back and forth motion and rotational motion of the knee. This ligament can rupture as a result of long-term degeneration, whereby the fibers within the ligament weaken over time, or it can rupture because of trauma or abnormal angulation during running or playing. Certain breeds, including Labradors, Rottweilers, Boxers, and Newfoundlands, may be more prone to this problem. Small dogs that have luxating patella, kneecaps, are more prone to ACL ruptures. When the ligament ruptures, the joint becomes unstable, which causes pain and leads to chronic progressive arthritis if untreated. There are different surgical options for repairing the damage. Which surgery is chosen depends on the size of the dog, the experience of the surgeon, and the surgeon's preference. It is becoming more common for orthopedic procedures such as this to be performed only by board-certified veterinary surgeons. The most common surgical repair procedure is the TPLO, tibial plateau leveling osteotomy. In a TPLO procedure, the tibial bone is cut and rotated so that its slope changes and a metal plate is affixed. This prevents the femur from sliding down the slope of the tibial plateau when the dog puts weight on its knee. CBLO, Cora-based leveling osteotomy, is a variation of a TPLO, where the tibial bone is cut at a different angle and a metal plate and screws attached. A TTA, tibial tuberosity advancement, is another option for ACL repair. In the TTA procedure, the front of the tibia is cut, moved forward, and a plate attached. All of these procedures result in a flattening of the top of the tibia to help the abnormal forces that are created with a rupture of the cruciate ligament. While any dog can have an ACL rupture, only larger dogs can have a TPLO, CBLO, or TTA surgery because of the size limitations of the metal plate used in the procedure. Smaller dogs have a surgery called an extracapsular repair to fix the ACL rupture. Larger dogs don't heal as well with the extracapsular repair procedure. They do better with a TPLO or similar surgery. This surgery is usually very successful with few complications, and most dogs have no need for any long-term pain-relieving medication.